everyone. My name is Bria Donaldson. I am the Kindred Birth Companion Doula Coordinator at SisterWeb, and today I will be presenting on the Champion Dyad Initiative, which is a long-term partnership between a community doula organization and medical staff sites. I would also like to give special acknowledgement to our co-founder and evaluations director and evaluations intern, Ali Quintos, and Aliana Almanar, just for putting this presentation together. So the birth of SisterWeb. SisterWeb was founded in 2018, and it is based in San Francisco, California. And SisterWeb works to dismantle racist healthcare systems, strengthen community resilience, and advance economic justice for birthing families and doulas of color in San Francisco. So prior to SisterWeb, some of the barriers that we've seen with doulas and clients start with financial barriers, same impacts of systemic racism as clients, the on-call lifestyle, and fewer resources specific to doulas of color. SisterWeb ensures that community doulas receive the tools, skills, and mentorship to succeed in careers as professional birth workers. Just some barriers also that we experience from clients also include systemic racism and implicit bias, lack of culturally congruent care, and financial barriers and inaccessibility. And also SisterWeb works as a network of culturally congruent community doulas and birth workers who work to ensure birthing people of color have access to culturally congruent and high quality doula care. So just an overview of the Champion Dyad Initiative. The CDI was established in 2019 and is a quality improvement initiative that works to ensure that all birthing people of color receive respectful and equitable treatment during their births and pregnancies. The CDI is being implemented at all 4 hospitals and 1 independent birth center in San Francisco with maternal care systems where Black and Latinx mothers receive perinatal care. The CDI sessions create opportunities for bi-directional feedback between SisterWeb and maternal care providers, for Black and Latinx clients to give input about their hospital and the care they receive, and to integrate doulas as core members of care teams and systems. So the CDI partnership sites include Kaiser, Sutter Health, CPMC, UCSF, SF General, and the San Francisco Birth Center. So some of the CDI goals include the site's hospital providers understand the SisterWeb community doula model and are referring all eligible patients in a way that respects community and birth workers. The site/hospital providers and SisterWeb staff work collaboratively to identify population data related to birth outcomes and increase awareness at each site regarding current inequities and quality improvement needed. The SisterWeb doula programs have close working relationships with providers and clinical staff, building respect between roles and sharing of resources and feedback. With the support of CDI sites, SisterWeb programs effectively and efficiently are able to collect data related to patient and doula experience and communicate back to hospital sites with a focus on action steps and systemic improvements. Site/hospital providers and clinical staff support SisterWeb doulas and their professional journeys with consistent constructive feedback and opportunities for professional growth and skill building. And lastly, all SisterWeb doulas deeply understand the value of CDI and the importance of utilizing/maximizing it as a tool that will help us accomplish our goals. So the CDI core components. So starting with the champions, each site provides at least 1 care team member to serve as a champion, a person dedicated to working with doulas and advocating for systemic change. CDI champions and SisterWeb reps first prepare for and attend regular monthly meetings. And in those meetings, we collect bi-directional feedback to share and present at meetings. Number 2 is communicate urgent feedback related to a staff or shared patient/client. And lastly, 3 is communicate changes and shifts to policy and procedures at respective sites. The relationships with providers at CDI sites. So CDI informs close working relationships between doulas, providers, and clinical staff. CDI plans regular quality assurance and community building activities to evaluate doulas' presence in systems of care, raise awareness of positive implications of doula care and maternal health outcomes, and develop professional rapport with medical care teams. The referral process includes before providers refer patients to SisterWeb, they must understand our community doula model, organizational capacity, and eligibility criteria. At birth sites, champions identify ways to strengthen the process and communicate ideas to a SisterWeb CDI rep. So implementation expectations with SisterWeb staff include SisterWeb staff focus on cultural competency, educating hospital staff on specific nature of SisterWeb community doula model, peer support, culturally and linguistic congruent support. SisterWeb staff build an ongoing inclusion of feedback channels. SisterWeb staff design a forum for feedback that doulas and providers can use. Build rapport between SisterWeb doulas and hospital staff through mixers or other fun events. And then implementation at sites and with hospital providers include create increased opportunities for community building and staff education at their site. Dyad reps provide logistical and administrative support to the overall initiative. Dyad reps are point people for addressing issues when SisterWeb doulas are working within the hospital site, and hospital reps will champion anti-racism at their site. So these are just previews for the CDI feedback forms. So as you can see, we have a CDI doula feedback form and also a CDI provider feedback form. The doulas are required to fill out a CDI form after every birth that they have, or also in events where there's situations that arise between clients and providers. And then the CDI provider feedback form is not required, but we ask that all providers fill out the form after they have a birth with a SisterWeb doula. We give them business cards with our QR code that gives them direct access to the form so that they're able to fill it out after the experience. So this is just some quantitative data that we have received from the this past fiscal year. So with the first box, you can see the instances that doulas provide feedback for CDI sites, which is at a total of 55. The next box shows on a scale of 1 to 10, the average level of respect from other medical providers reported by SisterWeb doulas. And we have an average of 8.71 for the fiscal year. The next box is the average level of respect from nursing staff reported by SisterWeb doulas on a scale of 1 to 10, and the average is at an 8.63. And the last box is the percentage of doulas who gave feedback directly to medical staff in the hospital when they did not feel respected or felt that their client was not receiving respectful care. And that percentage is at 71.53%. Here's some more quantitative data that we collected. So starting off on the left, you see the number of monthly Champion Dyad meetings between medical reps and SisterWeb reps, which was a total of 38 for the fiscal year. And then below, we have the number of instances of care coordination between SisterWeb staff and medical staff outside of monthly CDI meetings, which was 45. So this just pretty much illustrates how, even though we have these standing monthly meetings, that there is moments outside of those monthly meetings where we have to reach out to our hospital rep for support in various different ways. It also is just great to be able to have that access to that care coordination outside of those meetings. And I think for me, it's helping us bridge the gap and being able to have someone in those hospital sites that we can lean on when things arise. Also on the right, we see two graphs. The first graph illustrates in the average level reported by SisterWeb clients of feeling supported, heard, and respected by their medical providers during the pregnancy, birth, and postpartum, which was at an average of 8.8 for this past fiscal year. And then at the bottom, we have the same, but it is looking at the relationship between doulas and clients, and we have an average of 9.735. So as we expected, we would see that the average between SisterWeb clients and doulas will be higher. But we also can see that we do still have a pretty high average between SisterWeb clients and hospital staff. And our goal is to continue to bridge that gap so that clients can feel even more comfortable as the year passed between with their providers. But, you know, this just shows that there's still some work to be done, but we're doing a great job. Okay, so just some qualitative data that I wanted to read off to you guys. So we have pretty much just quotes from a provider, a SisterWeb doula, and also a SisterWeb client. So I'll start off with the medical provider. So the Kaiser medical provider shared that the doula was a great support person for the patient. The doula spoke the patient's native language, and the doula was supportive and present during MD visits, but did not provide her opinion or dictate care. The next is from a SisterWeb Kindred Birth Companion doula, and she shared, we had a great team of nurses and midwives that were very patient, care-focused, and prioritized patients' comfort. It was very nice to have the opportunity to collaborate with a group of women that assisted during my client's delivery. They allowed space for both myself and client's partner to provide physical and emotional support during active labor. And the last client is from a SisterWeb Semilla Sagrada client, and she stated that I would recommend 100% having a doula. because it was a huge support before, during, and after my pregnancy, especially during labor. Having their presence gave me strength on the moments that I needed the most. So I would just like to say thank you for watching the presentation. If there's any questions that you have, you can contact our Director of Evaluations, Ali Quintos, and there's her email below. Also, if you just wanted to keep up with SisterWeb or had general questions, there's our website, our email, and all of our social media platforms. And thank you again.